Tonight, a Nova special report, medical school. From the inside, we follow 7 students on a grueling 4-year journey. It's hard work.
I spend 6 hours a day of actively studying.
With tough lessons in life and death.
That's it? Oh my God.
Do they have what it takes? Join host Neil Patrick Harris for a revealing look at the education of your future physician. So you want to be a doctor?
Funding for NOVA is provided by Johnson & Johnson, the signature recognized around the world for commitment to quality healthcare products for the entire family. And Lockheed, a bold new force in systems engineering, management, and technology services for defense, space, and industry. Major funding for NOVA is provided by the Corporation for Public Broadcasting and by the financial support of viewers like you.
So, you want to be a doctor? Well, there are a couple of ways you could do it. You could do what I did, become an actor and play a doctor on a television show. That's the easy way. Or you could do it the hard way. Go to medical school and become a real doctor. Tonight, we're going to look at the hard way. Our story begins in the fall of 1987.
Well, when I first got in, I kept wondering if it was a mistake, really. Like somebody was going to pull me aside and go, didn't you get that next letter that said, we're sorry, but the first one was a mistake? And it was kind of strange because even though when I interviewed here and I toured the place, I really felt at home, I'd never really pictured myself in the environment. And I still, when I walk across the quad, sometimes I just it hits me sometimes, God, I'm at Harvard.
There are others that stimulate motility. There are others that stimulate pancreas secretion of bicarbonate, pancreas secretion of enzymes. The whole gut is talking to itself along its length about what's going on in other places.
September 1987. This is an introductory lecture in anatomy for the 165 students who have just arrived at Harvard Medical School. It's the start of a turbulent training experience which will, if they can survive it, turn them into doctors. NOVA will follow 7 of these students throughout their 4 years of medical school. Jane Liebschitz, at 26, came late to medicine after a year in Taiwan working in a health clinic.
Well, medicine, for me, is a big surprise to all my friends. I was voted in high school first to make $1 million, and everybody thought I would go into law or public policy or politics. And so medicine really came for me after I graduated from college.
Jay Bonner, 23, is descended from 3 generations of physicians.
I knew I couldn't be a businessman. I could never do that because I wouldn't care about any sort of product. I care about people.
There are renal branches that go
Cheryl Dorsey, 24, comes to medical school with a very clear idea about her future.
I think I chose medicine. It was a very calculated choice, actually, because I realized that I'd like to work in public policy and really, really make a difference at the national level in terms of setting the agenda for women and children of color and people who don't have the same opportunities as those of us who are more fortunate.
Tom Tarter from the Bronx, at 31, has already been a bouncer, auto mechanic, and psychiatric orderly.
First year medical school is absolutely something that one cannot be emotionally prepared for. No matter how much you feel that you've reached some kind of equilibrium in your life, I think first year medical school will upset it.
Before arriving at Harvard, all these students were high achievers. But medical school is much more than just another academic challenge. It's an intensely emotional rite of passage, a true test of character.
This may look, to look at this, I can imagine that if I saw a picture of this, I would think this was really, really gross. But being here with it, it's not so bad, you know? It really isn't.
they compromise the largest endocrine organ in the body.
These students' initiation into medicine will be complicated by an additional factor this year.
Spread out all along the body.
They are guinea pigs in a radically changed curriculum called the New Pathway.
You want to do head, ear, nose, and mouth.
Okay.
In this new approach, the traditional first-year diet of endless lectures has been cut back, and students no longer wait 2 years to begin learning the clinical skills needed for patient care.
You know, I used to get a lot of upper respiratory tract infections.
They see all kinds of ear infections. That might be one.
David Friedman, 23, is the son of a New York City surgeon.
I don't feel anything. This is the way my dad always does it. He grabs my neck and...
And Elliot Bennett Guerrero, 22, who studied biology and Spanish, is also from New York.
Now, already he's scared. All right, just relax.
Okay.
Okay, you just tilt the nose up a little bit, and you go in. What you see is a beautiful passage that angles up to the right. And you see this beautiful inferior terminate that kind of just passes right down where it should be.
Great.
Did it hurt?
Not at all.
Anita, you made that seem...
It did.
Okay, so you kind of start this medial and then go to the lateral. That's how she did it.
How did she hold?
No, she was way over this way.
Okay, right, okay.
To free herself up, right.
Okay.
Now, she pushed with her thumb like that to open it up, right. Right. I think that the fact that we've learned these clinical skills gradually and in these little areas with our friends and people that we know, rather than on patients, is making me much more confident. And I feel like I can try and not be afraid of hurting somebody. I mean, my friend will tell me it hurts, but a patient might just lie there and say, well, maybe the doctor doesn't really know what he's doing. And so it's made me feel much more confident about going and seeing real patients.
You see it?
I see it all.
How does it look?
Beautiful reflective triangle.
Really?
Yep, the little thing on top, that dot that we were supposed to see on top.
Yeah.
You've got a beautiful ear, Ellie. This is great.
Oh, really?
Yeah, it's great. Incredible. Oh, I'm sorry. You see, you can't go side to side. You can only look at the, sorry about that. It's the side to side that'll kill them.
After practicing the physical exam on each other, students move on to the real thing. Today, just 2 weeks into medical school, Jay will see his first patient.
Feels kind of weird. I was commenting. It feels like such a costume right now.
Yeah.
I'm trying to get used to it.
I feel like
still.
I'm...
Just before I met my first patient, I was all anxious. I don't know a heck of a lot now, clinically, about, you know, what to do when.
I want to introduce you. This is Jay Bonner.
Well, I don't remember good dear hi, but hi.
Okay. Well, Jay's the one that you're mostly going to be talking to.
At this point, we're really more learning. We're learning how just to perform certain fundamentals of exam, and also how to talk to somebody in a way so that you're not just shooting the breeze, but you're in fact getting the information you need to know and getting across to the patient the information that they need from you.
Oh, gosh, I'm going to take my hat off and show you my curls. Okay.
Well, I'd really like to thank you, first of all, for coming in to talk to us. It's
You're welcome, dear.
really helpful. And first of all, I'd just like to talk about your cough and what's brought you in to the hospital. And then after we talk for a while, I'd like to do an exam of the back of your chest to listen to. The patient has been treating you more or less like a doctor, but you're going to fumble, you're going to be a little hesitant, and you're sort of afraid that the patient will look at you and say, I don't want this person near me. Get this incompetent away from me, you know. If you could take off your top and put on the Johnny that we have, open in the back. You can leave on your skirt and the rest, and we'll all move over to this
You mean I gotta get nude?
No. We're going to close the curtains.
You want to see this body of mine? Okay.
You did a great job. That was very good.
We used to have rock and roll together for a while. We used to go to concerts together, and then we sort of didn't have something in common for a while. Now we have this thing called medical school that we can talk about.
This guy out in Williamstown, he's going to give me a job, probably. My father also went to Harvard back in 1967, and back then they didn't see patients until their third year.
I think medical school would have been much more enjoyable had I seen patients early in in medical school. I think that the changes are important in that they help people to understand that medicine is about treating patients, and to do that from right off the bat, that's nice.
It's helping me. It's helping me a lot. I guess the first thing I want to do is take your vital signs.
What's that?
Before I forget that. I'm still a little new at this, so it may take me a moment to find if you'll bear with me. Touching patients is not easy, particularly at first. I remember that was one of the hardest things I did with the first patient I did. That you are worried that they're gonna figure out how ignorant you are. I'm gonna put my hands on your back, and if you would say 99 in a loud voice, okay?
All right. 99. Jenna, wait a minute to catch your, Just got a little of that.
Yeah. Take a minute if you need it. That's okay. The other thing I wanted to know is if you have any questions, if there's anything you'd like to know from me.
No, darling, I just, one day you're going to be a great doctor, and I'll still be around to see you.
That's right. That is right. You will be.
Make incisions for the anterior abdominal artery. Make a vertical incision from xiphoid carpus to umbilicus, keeping on the left side about 1 centimeter from midline. It's just.
Right, and here's the ligament right here.
People had been telling me that before I came that it would be hard to do anatomy, but I'd get through it and it would be okay. And then we came in the first day, and it was worse than I ever expected it could be. And it looked so, our cadaver looked so lifelike and so real. And I don't know, it was really difficult. I started crying, I left the room. I started crying, but I was still here.
I would have serious problems to choose a doctor who never felt uneasiness with the cadaver. I mean, the more you feel uneasy, the more I have some element to think that this is going to be a compassionate doctor.
I think your interest kind of overcomes any anxiety or fear that you have.
Really? I mean,
after reading about it like all night in the textbook and everything like that, when you finally get to see it, I mean, all these things are very abstract, and you're trying to figure out, well, this goes here, this goes there, that goes the other place. And then, boom, it's in front of you, you can grab it, you can feel it. And to say, aha, this is what I read about, that kind of overcomes any feeling of mortification. Maybe this is a process of intellectualization, I don't know.
All the way down to this right.
Even the traditional initiation rite of dissecting cadavers has been affected by the new pathway curriculum.
Classical courses would have the students in great detail understand the names and the relationships of the muscles, the bones, the nerves, the blood vessels, in exquisite detail, weeks and weeks of work of knowing all of the minutiae. And we didn't give them all that time. So they were confronted with this dilemma of all this information and clearly not enough time to memorize it. So memorizing is not an option. They were forced to try to think about this problem in a new way. And that was to try to get the general principles rather than every little muscle one at a time. And so we asked the students to focus on either an arm or a leg, and they're assigned randomly to one or the other, that if you can sort of think about how one of them goes together, at some later time, if you need to, you can very easily understand how the other one goes together.
Yeah, it's very superficial.
I'm studying for our anatomy practical, which is in about 2 weeks from now. So I'm furiously trying to learn what we've covered in the past 6 weeks, which has been at breakneck speed. The information is certainly overwhelming, but I'm attempting to cope with it. And in a sense, there's really no need to panic because it's so overwhelming. I know I'll never learn everything, but I'm just trying to get a fundamental base of knowledge at this time.
Under the old curriculum, students were told what they had to learn. In the new pathway, they must discover what's important on their own.
I have a watch that is got a stopwatch built into it. And I spend 6 hours every day, not looking for books or walking across the street to the library or something like that, but I spend 6 hours a day of actively studying, which means at this desk, at a book, or in the library at a videotape. 6 hours. And if I take a break to get a cup of coffee or to go to the bathroom, I click off the watch.
Jane is on her way to the daily tutorial, which in the new pathway curriculum has replaced many hours of listening to lectures. Students now explore the science of how the body works in small groups, often using actual case histories as a guide.
Ms. Linda Bell is a 51-year-old bank executive who began to have hot flashes 6 months ago, which disappeared spontaneously with no further symptoms.
The first day of a case, we'll get a sheet of paper that says, so-and-so has hot flashes and bloating in her stomach. And as a group, we'll try to narrow down what are the possible causes. Is it menopause? Is she pregnant? Is she depressed? Does she have blood poisoning? I mean, just a whole gamut of things.
Could we start to predict at this time what we might be looking for with?
Well, menopause is very much associated with hot flashes, and she's 51 years old, and she hasn't yet gone through menopause, so.
I read a little bit about menopause last night, and I couldn't find anything about abdominal bloating. So that, to me, is another problem we have to look at.
Okay.
I think we should try to figure out what is in the left lower quadrant.
Harvard introduced tutorials because of widespread criticism that there was too much rote learning in medical school. But not everyone is comfortable problem-solving in a group.
Firm left lower quadrant mass.
Unlike Jane, Tom is becoming increasingly dissatisfied with what's happening in his tutorial.
Having to explain why the guy is wearing a pink shirt or something.
No, I mean, the pancreas secretes amylase, right?
Yeah, right.
But generally, it secretes it into the intestine, not into the blood.
Right, so the point is this guy has huge blood levels of amylase.
So why,
how are we
does
going to
that mean it's
explain
not
black
going to the
stools,
intestine?
diarrhea, hypertension, low hematocrit, and vomiting?
Well, I don't know. I think there comes a time when you
Is this guy anemic
don't
from...
have to explain everything.
Well, I mean, is this guy anemic from chronic alcohol use?
These things can be complete. I'm lost. I feel like I don't know what to study, that I might be studying some things too much and missing important concepts that someone could just say, hey, this is really important. You should know this. You should examine this. But nobody tells me that.
I mean, I'm not sure what the mechanism is. I just know empirically that there's a saturation effect, right? There's just one enzyme that breaks down.
I understand intellectually what they're trying to tell me. They're trying to tell me that I need to discover what's important for myself. And by discovering what's important for myself, it will be made real to me, and I'll never forget it. And this will serve me in the long run, as my medical education will continue throughout my entire life. I understand that, and I accept that. However, what I feel intellectually and what I'm able to handle emotionally is quite separate. I'm not particularly satisfied with what I got out of the last 8 weeks. If I had the choice of pursuing what I consider an essential body of medical knowledge to being the kind of physician that I want to be, then this clearly was not the most direct route.
I mean, give me a break. If you don't like it, it's 1 hour a day. And if you want to pursue all this stuff on your own, go pursue it on your own.
That's not really true, though. I personally feel that I paid a great deal of money to consult and to have the expertise and the expert guidance of people to point out to me what I should know. And this is clearly not what these people want to do.
Well, why come to Harvard, then, is the big question that would enter my mind.
Well, I tell you...
You don't know if you want new pathways.
I'll tell you something. That's really what was a tough choice. It was. And I sometimes wonder if I made the right one. You know, in all honesty.
Too. That's why I asked the question, if you're so unhappy with the pathway.
Yeah. This has been the most emotionally trying period of my life. I've been through a divorce after 10 years of marriage. I was an Olympic hopeful, got knocked out of the Olympics because of an accident and an injury. I've had to work for about 14 years to get into medical school. And I can't ever remember crying until last week. Last week I just had to start crying. I was talking on the phone to a friend of mine, bang, and it just happened.
This afternoon, in the course where we learn how to examine patients, I'm going to do something which I'm a little bit anxious about.
In the pelvic examination, you should remain aware of the patient's vulnerability and fear.
Now we're going to do the pelvic examination. There are several parts to that. First, I'll be doing an examination of your external genitalia, and then I'll be using this speculum.
Follow, you see how you feel the curve here on the top? Just follow that right along, and you'll feel right in the side.
And let it down.
Right around here?
Simultaneous going in further while you're going out.
No, you just pull your finger out, and then
Now-
rest it for a minute, and then go
Should I
a little
brace?
further.
Should I brace the woman, or
No.
she'll be braced? Her weight is.
You don't,
I'll
right
brace her
now
for
he'll
you.
hold. Right now he'll hold the model, but you don't have to do that.
Only
In fact, it's probably advisable for you guys to put your hands as little as
Right.
possible on the woman. Okay, honestly, just
Be as official as
do
possible.
what you have to do, but
Right.
okay.
Right. I'm just doing this to the point where you seem cold and
Oh,
insensitive.
absolutely, I'm not saying that.
I mean, you could take it to an extreme.
I think it's much more comfortable to be able to just deal with it at this level first. I mean, there's no doubt that just because of all the various other connotations that you have with this entire area of the body, it's hard not to giggle a little or...
No, it's opening up.
Hey.
What do you see in there, Elliot?
I think it's got to be harder for a man. I
That's what I was thinking. Boy, do I feel sorry for
I
these
felt
guys.
uncomfortable just watching them go over the sexual parts because you always view them as sexual parts. You don't view them as a clinical thing, and so it's just very hard to adjust. Up and I push down, and now I'm looking in. Up. That's right. My fingers should come out a while ago.
Good coach. Okay, let's do it again. Okay.
In December, after 3 grueling months, Tom takes a break to visit his girlfriend Stephanie, also a medical student, and his mother in the Bronx.
That coffee table has a nice little touch with those yellow mats.
Well, it's a little too French provincial.
He was always a little different. I always used to think he was a little too smart for his own good.
This is what we lived on right here, Bronx pizza.
Our main staple.
This got us through college. It's not getting us through medical school, but it got us through college.
Speak for yourself.
He was always interested in science, and when he was very young, his first interest, I think, was in atomic energy. And he was 3 or 4 years old. He'd have me reading books about atomic energy. And then when I'd finished, he would say to me, Mother, I know you didn't understand that. Now let me explain it to you. Do you know what it's like having a 3 or 4 year old explain to you about atomic energy?
Okay, here's the guy you wanted to know about. This is the guy that married my ex-wife, the schnoz.
Your ex-wife.
That's right, my ex-wife.
Ex-wife. Okay, how about this one?
Oh,
This one's my...
You like that one, huh?
No, no. That looks like Charlie Manson was the member of the...
It's not Charlie Manson. It's me in Yosemite, and it was raining, and I'd ridden for days in the rain. There we are. I'm trying to remember where this was. I think this was in Tennessee.
One of my favorites.
I can't say it's one of mine.
What don't you like about it, Mother?
You look like the Neanderthal man.
I think he looks like a Renaissance prince.
What's Neanderthal about it?
Oh,
Huh?
my gosh.
What's Neanderthal about it?
The whole thing.
The flowered
Because
shirt.
no, if you just had
bearskin,
whatever.
Oh, a Tarzan suit.
Yes, a
Yeah.
Tarzan suit.
I should wear a Tarzan suit.
Right, and a club, and a cave.
Well, we've done some deep dissection on this woman, so it looks pretty fearsome. It's in a little state of disarray, you might think, but it actually makes sense. To the trained mind, that doesn't necessarily mean mine. When I first was working on the body, it was in one piece, and it was relatively, it looked like a human. I certainly had a lot of feeling for the person and everything. And I still have those feelings for the person. But now I feel, I feel bad about the, apparent mess. It just looks terrible. I don't know why I should let that bother me. I really don't, because I've learned a tremendous amount from it, everything like that. But there's something about this leg in this bag. I mean, now I start taking parts of this into another room, take it into another room with someone else, plop it down next to their leg, and now if you're not careful, you can almost mix the two up. It's like they don't belong to a person anymore after they cut the body in half. It was a very personal thing. I felt very like a personal relationship, with this lady almost. It was like she was, she had made a gift to me, or to, medicine, and I was really doing exactly, what she had hoped.
This is an awful time of year, academically and also just personally. Boston is cold and dark, and people have not seen the sun for weeks, months. I personally have been fighting, the doldrums, physically, mentally, emotionally. I think part of it is that it's so stressful. This is so stressful, and everybody warned me about it before I came, and I just sort of said, I'm gonna fight it, I'm gonna make it so medical school isn't tough, but it's really draining, and I think it's hard to be a whole person while you're going through this.
If you take a look at the more detailed scheme that you have, and you, I'm sure, understand very well, on page 8. On page 8.
I was involved with an absolutely fantastic woman at the beginning of the year, who I really loved, and I still love her. But due to the stresses and everything that came about in my first year of medical school, we just don't seem to be able to get along anymore. It's unfortunate, but true.
It's depressed in two ways, apparently. One is the synthesis of the protein of that enzyme is messed up at the transcription level, as you'll see in the next slide with a more detail. Secondly, ACAP, that is acyl-CoA.
Being in medical school is a very, very intensive process. And you really need some time where you can just sort of put that aside and really think about other things. Also, art has been important to me for a very long time. And it's, to me, as much as anything, a symbol that I have a life outside of medical school. And I want to keep it alive. It's that piece of me that I will save for myself, and I will not let medical school get to me.
This heart is just about the size of my fist. Beats since the day you're born to the day you die. Corresponds to every stress needed, being faster, stronger, depending on what you want to do, and never stops.
In the autopsy that we were involved with Dr. Schiller, we were allowed to see what a pathologist does. And although none of us are pathologists, and we're not even doctors yet, we're just students, and most of the time is spent with books, we got to see how the stuff we learn in these books becomes real.
Brainstem, all right? They're the cranial nerves. They're the olfactory bulbs, all right? So there's a lot of structure. I don't want to get into that, but I just want to show you that this is a perfectly normal brain. Probably normal weight and normal shape. Hmm? Who would like to tell us what we see here? Who hasn't spoken? Ah, Mr. Bronx. First of all, what organ is this?
Looks like liver to me.
It sure is, okay? That's liver.
Need a lot of onions for this.
And by the way, the liver, is this normal color for liver?
Actually, it looks pretty normal to me.
Yes, it is. And do I see something?
It looks spotted.
Good, spotted. That occasionally you get a person who is born.
Up till this point, I've always seen the body from the outside. I've seen people move through space, play sports. I've seen them eat, all the natural biological functions that we go through. But I've seen them all from the outside. And what goes on in between, say, the mouth and the anus has been a mystery. It's just something that happens, only, to be known in the vaguest sense. Now, I'm learning, actually, what it is that's going on inside there. I'm familiar with it. I've seen it. It's now a part of my world. And when these processes, these natural biological processes take place, they're completely demystified. I understand them. I can see it. I find this just an immensely satisfying extension of myself, of my realm of experience.
I felt pretty bad when I walked out of the exam today. And I think it's just because I've basically given up everything in my life, and I hope to walk out victorious feeling like, yes, I've learned something, or yes, it's all worth it. But I'm not sure that it is, and I'm not sure that I have. And I've just given up an awful lot.
I feel wonderful, relieved, tired, ecstatic. Any more adjectives? I feel great. I feel perfect. I feel like a person who's ready to start their summer and do nothing, relax, enjoy myself. Thank you. So see you there.
I know right now is not the time to make a decision whether the price is too high to pay to become a doctor, which is what I want to do, but I sometimes wonder whether it's all worth it. Hey, it's great to be able to listen to somebody, and it's great to be able to intervene in somebody's life, but it's just so stressful, and what about my own life? That's what I wonder.
I thought doctors really knew what they were doing, and I really don't feel like they know as much as I ever thought they knew, because the science is still very iffy in so many cases.
It's absolutely fantastic. Today is the most important day in my life right now. I really feel confident that I can do the work. I feel confident that the program, as it is going to work for me, and that I'm going to become a good doctor, which is the most important thing in my life. Ready?
Now that I'm in year 2, I'm finding that it's very similar to year 1, except that in year 1, which deals a lot with normal anatomy, normal physiology, in the second year we're dealing with how disease affects the human body.
I have AIDS. I never thought it would happen to me. I have AIDS. And part of
I was very struck by the severity and the fear that is involved with an illness that threatens people in the prime of their lives and really takes life dramatically and quickly. So it was very frightening to me to see someone who was not that much older than myself, who would probably not be alive in the next 10 years.
I was wondering if now that people, I hope, are becoming more educated, is there sort of a push to help people live with AIDS rather than just say, well, this is what you're going to die of? Is there something to educate you and say, well, this is...
I think at this point, if you're diagnosed with AIDS, it's not quite the kind of like, this devastating kind of pronouncement where you just expect any minute to die. I think that most people do cope with living with AIDS. I have friends who've had AIDS for 4.5 years, for 2 years, but then I also have some college classmates who died within 2 weeks of their diagnosis.
We all deal with it differently. And for me, no matter how hard you prepare and I am doing a lot of preparing and a lot of preparing of the people in my life. I still can't quite imagine not being around.
I never did get to meet you, like, you know, in the first year of class or anything. Where are you from?
I'm from Birmingham, Alabama. I was there until I was about 12 years old, and then I went to New York. And I was there until I finished high school, and then went back to Alabama. So whichever one you decide on, I was born in New York. So.
Where do you live in New York? I'm from New
Queens, St. Albans.
Sure. I don't know Queens that well. I'm from the Bronx. It's kind of like another planet, you know. I mean, I don't know, like, Queens or Brooklyn.
Oh, I know the Bronx, though. I used to live in Harlem. My mother worked at Lincoln Hospital, like down in the South Bronx in Fort Apache. So.
What do you think of Boston? Do you like notice a big difference between Boston, New York?
Yeah, actually I do. I'm gonna be in Boston for a while, so.
So you don't want to say anything bad about it?
Do you want me to take it? No. Let me just sit down. I'll just put it back over here.
As I said over the phone, we said in the lobby, the purpose of our exercise today is to have you inform us about your experience of your illness and your recovery from it. And Jane will be the interviewer, and what we'd like is for the two of you to get in a conversation. David and I will just sit back, okay? But we'll leave it to the two of you to get into it. Okay? Yeah. All right.
For me, who's a totally non-scientist, to be able to go and see patients and sort of, that's my strong point, I would think, dealing with people, to go and see that it's a sort of an ego boost. I can do something well. I'm not overwhelmed all the time by all this science. So I really look forward to that part, and I also look forward because it's so much more meaningful to see it in a real live person. Basically, you feel fine in terms of your heart.
Since I've had the bypass surgery, I feel, but there are some times when I get excited, you know, and things just don't turn out. It bothers me, and I have to take a nitro, but not as much as I used to take it.
What kind of things get you excited?
Well, things don't work out right, you know, things in the home.
What about in sexuality, or your sexual relations, your wife?
No more.
No more?
No more.
Has that been recent, or is that?
It's been since I've had my angina attack. It seems like, well, I'm afraid.
What are you afraid of?
Well, I was on a program in the...
Very few people in this world have the honor of listening to people's innermost thoughts. When somebody can tell you things that they don't even tell their spouses or their friends or their family, you really are in a privileged position, and it's really exciting. Maybe I'm just a little nosy that I like to hear people's lives, but it's the reason I'm in medical school, is to see patients.
I asked her for the doctor's address. I wanted to write to him and ask him questions. She says I couldn't do it, and I asked her why. She says the doctor passed away from having sex. So that frightened me, and ever since then I've been kind of cautious.
I think one of the things I'm learning in medical school is that I like problem solving. I think I get a lot of gratification out of helping people who have something that I can treat. That's why I think I may be leaning towards surgery, where you see a patient, you try to help them. Sometimes you can, sometimes you can't. Dan, how long do you think this case will take?
Well, I don't know.
2 hours?
She's a little peculiar because she has this hardware in, and so we're going to have to use a little bit unorthodox approach from a technical standpoint.
I guess I watch Dr. Cabot do surgery every couple of weeks. I mean, primarily because I'm interested in going to surgery, and it gives me a good opportunity to see some clinical work being done. I get to speak with the anesthesiologists and the nurses and the various surgeons. You know, it gets a bit tiring just learning basic science all the time, and this is a great way of being able to, you know, see medicine in practice.
In a reel.
Where's the bogey time?
Down there.
This woman is having a cholecystectomy. That is, her gallbladder is being removed.
The case is over.
I get very frustrated when I can't help people. And I want to go into field of medicine where I can try and fix them. And if it doesn't go right and if they don't get better, well, that's really unfortunate. But then I can move on and try to help other people through surgery or through more procedural-oriented kind of medicine. You see a patient, you try to help them. Sometimes you can, sometimes you can't.
They told me in the financial aid office when they figured out my loans for the whole 4 years that the day I graduate, I'm going to owe $180,000. And then it's, of course, going to build up in interest.
Oh my gosh,
capitalizes, so the capitalized interest here.
That's right. That's right. And you're 150,000?
155,000.
I was complaining at 120 something
Well, it's
thousand.
funny because they figure out how much you're going to have to pay back each month of your residency. I know, I have $15 left. I have, yeah.
Are you kidding?
$15. I have to pay back $1,500 a month if I do the 10-year payback. And you figure at that time that you're only going to be earning maybe $2,500 a month at the most. They wouldn't do it if they didn't think you could pay. The bank isn't going to lend you money. They don't think you can
But
pay
I mean,
it
what are
back.
they assuming though? Because if I want to do pediatrics, I'm not going to be making a lot of money.
I think it forces you to go into things. I mean, it limits your options. How could I go practice in an underprivileged community?
And have to pay back.
There's no way that I can. There is absolutely no way that I can.
I think what we'll do today is before you try drawing blood on one another is we'll just repeat the demonstration.
I've never drawn blood before, and I'm very nervous.
You want to go into it someplace where you can really see and feel the course of it.
I think drawing blood is the most difficult thing I've had to do in my whole medical school career.
More than the cadaver?
No. Yes. No. No, not more difficult than the cadaver.
Come on, people, give Freddie a break.
Actually, I think I'm less worried about this than I was about the female pelvic exam. But,
I wasn't worried about the female pelvic exam.
Angle it down a little more. You try that. Okay.
I'll do you or you do me?
You do me first. I don't know how to do this. Am I not going to be able to do it again here?
Well, can you still feel the vein?
Oh, you twist this thing. Oh man, this needle can kill a horse.
I think so. David, will you shut up?
Sorry.
I can, it's still
Over there, man.
I got in there like one of the first things was coming out of it. Like,
I think you're in it.
Try putting your hand behind the syringe instead of
Like
on top
this?
of it. Yeah, right.
And just go amen?
Just right into the vein. Start, toward this end.
Like here?
Sorry, guy.
You only get 3 chances, man.
Don't worry.
It really doesn't hurt that much if you do it.
I'm shaking.
Ouch. Sorry about that.
All right, that's strike 2, man.
Strike 2. We're even now.
It's okay. I haven't had a pulmonary embolism in a couple of days.
Yeah, you got it. That's beautiful. I'm just practicing.
Might have just been a little bit off to one side.
Try my legs.
I have to go for your neck, Dave.
Today's the last day of my Introduction to Clinical Medicine course, and I'm going to be evaluated by Dr. Alan Goral, who's the instructor for the course on my history taking and physical examination skills.
Now, the way we're going to do this is I'm going to be the patient, so that I'm going to be simulating a real patient. The story I'm going to tell you is really a story from an actual patient, and your job will be to take a history and do the appropriate physical, as you would normally do with a real patient in the outpatient setting.
Okay.
The second is I'm going to tell you what it felt like.
Okay.
And I'll also tell you not only how it felt personally, but also how it felt to be examined.
Okay.
And getting a real sense of that you actually not only put your hands in the right place, but you felt what you were supposed to feel.
Okay.
And that's it.
Okay.
Come on in.
Okay.
Come on in.
Mr. Simon?
Yes.
Hello, how are you? Feeling okay today?
Oh, I'm a little bit scared. And,
Okay, we'll talk about it. My name is Cheryl Dorsey. I'm a second-year medical student, and I'll be spending some time with you, and we'll sit down and
thank you.
Discuss things. Okay, now.
By the way, thank you for seeing me on such short notice. I really appreciate that.
Okay.
I'm pretty nervous about what I have. And,
okay, you do seem a little nervous. Can you tell me exactly what brought you into Mass General today?
I've had this feeling here. It's not really a pain sometimes. It's more like, I guess, a tightness or maybe a pressure. Tight feeling?
Tight feeling.
Yeah.
Okay.
And it's all over here.
All over, okay. Now you're describing it. Is this just right in the center of your chest? Would you say that it... it's fairly stressful, actually, because you have of course, it's a simulated event, but he's, of course, a doctor, so he's a very knowledgeable patient, and as soon as he said, I'm having heart problems, my heart just sank, because I said, they tend to be the most difficult cases, and all these questions that I know I should have asked, I'm sure I didn't. So it's actually kind of frightening, because I could kind of mentally hear him checking away, saying, well, she didn't ask me this, she didn't ask me that, and when she didn't focus on this, so it's very stressful. I'd like to listen to your heart in two positions. First, you sitting up, and then you lying down. It gives me a better sense of what's going on, so I'll just start, and take a listen to your heart. Okay, very regular. Nothing.
Good. Nothing sounds bad yet?
No, not at all.
Okay.
I'm just listening for the heart sounds. You have two normal heart sounds, S1 and S2, and they're there, very clear.
Okay.
So I'm just getting a good sense of what's going on. Better to always check.
Okay. You showed again concern for my comfort. I was very comfortable during the entire exam. You did not move me around excessively.
Okay.
Overall, I think you're exactly where one would expect you to be at this stage of your training. You should be proud of yourself. You are warm. I felt welcome. And as you gain a little more confidence, you will do a very nice job, and you will be a superb clinician.
Oh, well, thank you very much.
So I'm really pleased with what you've done.
Oh, I was so nervous.
And we'll take a few minutes to go over that.
Now here at the end of my second year is a very different experience at the end of my first year. And I don't know whether it's that I've been socialized into it or I've had some more experiences, but I feel more committed to medicine than I did last year. I feel like I know more medicine. We learned diseases this year, and that I think was much closer linked to medicine. And I still know that to be a physician, especially to train to be a physician, is very strenuous, very demanding, has its rewards, and I know that this is what I want to do.
And check out your wrists.
The second year show is a tradition at Harvard Medical School.
And hug your ears. And
It takes place after our 2 years of basic science courses before we begin our work on the hospital floors.
silent scream, ready?
Yeah, we've been working like dogs for 4 weeks to put this on.
Diction, watch Bill, have a great time. I hope you've all had a great time working on this show.
Since it's all in good fun, you know, doctors can have senses of humor also.
It's a great experience for us because it enables us to spend a lot of time with each other before kind of losing touch once we get out onto the hospital floors.
Start killing and you know it's neuroleptic time. Block D2 receptors all over the place. Rapid John MD is in your face. Means a limit blockade. It's antipsychotic. Motherfucking hip hop is so hypnotic. Not gross striatal. D2 block will give you EPS. Make it stiff as a rock. Say open wide and you know they will. Sunk down, lithium, become the chill pill. How do it work? I don't know, but it does the trick. That's good to go. But the side effects might steal the show. Cause they're rough, sure enough, I'ma let you know. Therapeutic index of only 2. Trying to get you shaking, but when I'm through. Set a proper goal and not condone a job postponed. Who must work the
Before our students can move into the hospitals for the last 2 years of their medical school training, they have one final hurdle to pass.
You have 30 minutes in which to finish this test book. Please recall that only those responses recorded on your answer sheet will be scored. No additional time will be allowed for
The National Boards is a 3-part exam which we're required to pass in order to become licensed physicians in this country. It's a 2-day exam with hundreds of multiple choice questions covering the material we've learned in the first 2 years of medical school.
I guess it's sort of a contradiction that we spent the first 2 years sort of learning concepts and how to study and thinking in very broad terms, and then you get this, you have to take this test that's really a lot like Trivial Pursuits.
Talking to everybody in the room, everybody feels like, I can't believe how little I know. And we're all used to taking tests and knowing.
Getting 90%.
80, 90%. You know, we all did well in school. And to come in and be given a test where you know nothing, it's really hard.
It feels like it's such a poor test of what I really know. It's not a great indicator of me as a person or me as a doctor, anything like that.
So, but I thought it was
I know the difference between those three.
I know there's
forgot
myosin
it.
and actin, and I don't really know how they
And
interact.
I know there's
Got that.
tropomyosin and troponin, and one goes on one and one goes on the other.
Troponin's in skeletal, I know that.
Oh, no, but one's on the
Is
actin.
Dantrolene at the
one's on-
sarcoplasmic reticulum?
Yes, it's the only one that acts there.
It's wonderful. I'm thrilled to be finished, but quite tired. I can look forward now with expectation to my wedding, which is only in a week. So you're all invited.
Jay's been quite a bit different than he usually is. He's very tense, wouldn't you say? It's hard to anticipate exactly what this is going to mean. I think we're going to have to be in a position where we can work on these things, because otherwise I don't think it's going to work. I should be more positive.
No, we should be more specific. It's already been an issue that I'm in medical school because it creates a certain amount of stress. I think we both hear like awful things about how little time residents have and things like that.
It's almost
And-
fatalistic. In fact, people say, "Oh, you're going to marry a doctor," you know, and they sort of look at me knowingly, you know. And
Will you now repeat after me the vows you
Between
have
second and fourth year, something happens. I mean, it's not like a hormonal surge. It's more like I don't want to be an intern or resident alone, and everybody gets paired off and linked up, and these diamond rings start flying like popcorn.
I now joyfully pronounce them husband and wife. Go in peace.
Now that I'm married, I think the next major event in my life is going to be going into the hospitals. After 2 years of going to classes, I'm getting really tired of it. I'm ready to go in and start working with patients firsthand.
Having successfully negotiated the first 2 years of medical school, our students now move into the hospitals for 2 years of training in clinical skills. Here, they are exposed to all the major specialties like medicine, surgery, and psychiatry.
But when I'm taking reproductive medicine, you know, or obstetrics, I'm very interested in that, and then I think, oh, it would be great being a OBGYN. It sounds very interesting and a lot of fun. And then when we do cardiovascular pathophysiology, then I want to be a cardiologist. It's like a kid going into a candy store. It's overwhelming. I mean, it's just so much there, and there's just so much that you'd like to do, and that, you know, there are all these new things.
And the PCO2 are pretty consistent with past, but the PO2 is low. A little. So I'm working on it. Okay, and I guess you'll be by to see him.
Since I'm so new to this, I don't really understand what you do in the emergency room, but I think what the idea is to evaluate how seriously ill somebody is. You know, if they're in a life-threatening state versus somebody who has a chronic problem and is just coming in because they've had the same chronic problem and doesn't really need to be treated, or somebody who just has a cold. who comes in because they're worried that they're sick. So we sort of try to evaluate the seriousness of every disease, every person who comes into the emergency room.
I review this later. It'll
Who
come
signs
across my
this?
desk.
A
You do.
signature. I'm not an MD.
Go ahead and sign it then, and I'll sign it after.
Well, we can get Drew to sign it.
Yeah, somebody
He's
else
right
will
there.
sign it.
How are you feeling? What? Having trouble breathing? You have bronchitis. Okay.
Come here. Give us a good cough. Do you feel worse or better today? Feel better?
Mr. DeMasi is an 85-year-old gentleman who lives in a nursing home, and he has bad lung disease, and he also has bad kidney disease. He's been in and out of the hospital for past periods in the past few years with a pneumonia and problems with his kidneys. In the nursing home, they noticed that when he was coughing up, his sputum was green colored, which is not normal, and that his color didn't look good, and his physician sent him to the hospital today to be evaluated and admitted if that looked like that should be the thing to do.
Now, would you call that? What do you? I just want to make sure I'm hearing the same thing you're hearing.
I said up about this level on both sides.
Real?
A lot of very moist sounding crackles.
Crackles.
And then above, from here up, it's got pretty good breath sounds with a fair number of wheezes mixed in.
Mm-hmm. Okay.
So for this lower stuff is what we're seeing on the x-ray of this old pneumonia that's being cleared.
Okay.
Okay, Mr. DeMasi, let me get you.
I felt that, gee, I really learned something in my first 2 years of medical school, and now here I come to the wards, and I feel like I know nothing. I mean, I feel less than competent, and even when I do know something and somebody asks me a question, I can't even think of the answer. I mean, it's like I can't even access the information I used to know, and so that's really frustrating, and it makes me feel on edge all the time, because everything's new, and it's like going to a country where you don't really speak the language.
Okay. Now, you've had this before. Might hurt a little bit, but not too bad.
Taking blood has been the bane of my existence, but now that I'm doing a little bit more, it doesn't seem so scary to me. It's almost scary that it's not scary anymore, because, entering somebody else's body with a needle is really, an invasion. It's like intimacy, or, with somebody else who you don't know, and, when I think about it, it's pretty heavy. But now that I'm doing it more, it doesn't seem like such a big deal.
I know it's painful for you. I know.
There, it's done. It's done. Oh, I'm sorry. I'm sorry. We're going to admit you to the hospital for a few days.
They're going to keep you for a few days, Daddy.
Two things. We're going to keep you in the hospital for two reasons. One is we want to make sure you don't get pneumonia. You don't have pneumonia, but you might get it. We want to keep you, make sure you don't get it. We also want to move some of that sputum in your chest.
They have to get that all up.
You have
Daddy.
too much stuff in there right now, and we want to help you get it out, okay?
All right?
Okay. We'll only keep you for a few days. Your daughter will come visit you.
What else is new?
And fun and games, okay? Beth Israel Hospital. And all of a sudden, there was this huge rush. All these people were coming in. There was all these, people in uniform, emergency technicians, and this man with this thing in his mouth, this bag, and people were just, making him breathe, and there was people pounding on his chest, and so they were unstrapping him, and people were taking off his shoes, and it was like 1 million people working on him, and I was sort of just watching, and the nurses started doing the compressions on his heart, pumping his chest, and they were trying to feel for the pulse. And the nurses were squeezing that bag and making compressions. And then I was sort of just standing there. I think I like helped take off his shoe or something. And then all of a sudden one of the nurses says, "Jane, do you want to do compressions?" And it's like, there must be Jane. And they were like looking at me, and I said, "Okay." And there was like a little footstool, and there was a nurse there, and I said, "Well, should I do it on the side?" She said, "Yes." So she like stepped away, and I got on the stool, and I started pumping. And then I looked at his face, and his eyes were like rolled back in his head, and I don't know, it was really, he was like really a person all of a sudden. And then I just was thinking, how come I'm sitting here doing this when I don't really know what I'm doing? I mean, I do know what I'm doing. I mean, I should know what I'm doing. Finally, I was doing compressions, and I started to get tired, and I said to the nurse across from me, "You know, I'm getting tired now." And all of a sudden the resident said, "Okay, stop." Like the code was done. We weren't going to do anymore because he was dead. I just sort of said, well, what am I supposed to do now? You know, it's like, what's my job? No one was coming over to put their arm around me. I mean, because that's not what happens here. So that was my experience today.
Oh, yeah, okay, good.
How long have you been seeing Mrs. Kelsey for?
Oh, what? She's been a patient of mine for a long time. I delivered her first baby.
Well, last week I was doing obstetrics during the days, and then I'd be off at nights. And now this week, I work at nights, and then, you know, well, at least I try to sleep during the days. I start in the hospital around 7 or 8 o'clock at night, and I go till about 10 o'clock the next morning. And, you know, the hardest thing about it is just your whole sleeping schedule gets all screwed up. Well, right now we're going to be giving a cesarean section. It should take about, you know, less than an hour, and it'll probably be pretty uneventful, and we'll be able to pull out a nice, healthy baby and give it to her. And, you know, she'll be sore for a few days, but I think I've been involved with about 34 deliveries so far. And probably, you know, by the end of the 2 weeks, I'll probably have done about 45. And what's really nice is that as you know, get a little bit more experience, and as the attendings and the residents get to know you, you get to do more and more at each delivery. You know, so the first couple I was just watching, and now lately, you know, I help sew up the episiotomies, and I can actually deliver some of the babies myself. So it's a lot of fun.
See the yellow?
Yeah.
So you can see once you get through the dermis, then you can start to underline.
That's anterior.
Do you want to tie on?
Sure. And I'm thinking a lot about, you know, becoming an obstetrician gynecologist. Because what I think is nice about it is that you get to operate and do procedures. And, you know, it's a happy specialty. I mean, with most of the women who come in here, you're almost assured that within 24 hours, they'll have a baby. It's a happy specialty.
Okay.
Here we go.
Here's the baby part. Baby's coming out. Come out, come out. Okay. Oh, it's cute. Oh, she is cute, yeah. Okay. She's 714. There you go. Ah, it's a boy! Oh my goodness. An 8.5 pound boy.
He's cute.
There you go.
Come here. Come here. Holly, here he is. Here he is. Oh, boy, he's kind of big.
And it's really nice when at the end of delivery, the baby's already out. It's nice to see how happy she is, and it's, you know, I've had a couple of women kiss me after the baby's delivered, and you know, it makes your day when that happens. You know, one couple gave me a box of chocolates, and it made me feel special. It made me feel very happy that I'd shared this important moment with them.
At the end of every rotation, students receive an evaluation on their performance. These grades not only influence the students' choices of future specialization, but also where they get accepted to do their postgraduate training. In a few days, Elliot will find that his grade in obstetrics and gynecology was not up to his expectations.
I was very disappointed when I saw my OBGYN, you know, course evaluation grade, because, I mean, not only did I think I worked hard during the rotation, I really enjoyed it. And for several months, I was actually considering OBGYN as a career choice. And I think for that reason, it particularly hurt me when I didn't do as well as I thought I was going to do. I felt that a lot of the people weren't honest with me. And, you know, if they felt I should have been working harder, or if they didn't like me, nobody ever told me. For that reason, I was particularly disappointed.
Good, Jane. Okay, I'll see you.
You said you were abusive.
I was abusive, I guess, towards Bill. I was angry. Things would come out when I drank, and I would be angry, and not abusive in a physical way, you know.
I've been meeting regularly with Gary, who is a person who's had a number of painful issues in his life that he's been struggling with. I think that's made him somewhat depressed.
Help yourself in that situation in the future, how you could make yourself more safe.
I've been struggling to find a way to help Gary confront his alcoholism.
What sort of thinking have you done about that?
I don't know. I just have thought about going to an AA meeting with the AIDS Action Committee, with people who have AIDS and ARC, and
I think it's a good idea that you're thinking about AA. I would support strongly your going to that meeting. If it's not right for you, you should know that there's hundreds of different meetings in AA. Would you be willing to go to several and see what looks good and what doesn't?
I think right now I don't see any need to drink, and I don't feel any need to drink, and I don't feel I'm going to go out and blow out like that.
You really need to get safe from alcohol.
Mm-hmm. Okay. I'm aware of it. What more can I say?
Do you see any dangers with being someone who admonishes something as strongly as you did with the patient?
Tony Morrison, he's one of my supervisors, and I find his feedback very helpful.
It's obvious that you see the positive side of admonishing that. That is, hopefully, that if you do that, the patient won't use alcohol, which is obviously a danger to him. But is there another side to that?
Well, obviously, you don't want to hurt the alliance you have with the patient. And
It seems that it might have been a role that's foreign to you to be so firm in admonishing something.
yeah, I guess that gets at a lot of my own feelings of being young. You know, who am I, inexperienced, to be telling you what to do? I mean, I'm only saying this because I heard, you know, some other psychiatrist say this, and while I believe it and really respect the opinion that's of the other psychiatrist, it still feels like I'm not speaking from my own authority yet. It's not something that I've seen enough of to feel as though I'm speaking with my own voice.
Mm-hmm.
My next clerkship will be neurology at the Beth Israel Hospital.
Miss Brown?
Huh?
Miss Brown?
Yes.
Hi, how are you today?
Oh.
Miss Brown is a patient who was in the hospital and unfortunately, while there, fell and broke her hand. I was asked to see her and do a neurologic examination to see whether she might be unsteady.
And I was so happy to get that Bible you gave me. And I've been praying for you, and I know you were praying for me because you said you would. And I believe you are a Christian, and I know I am. So I hope and pray that God will bless you all. And I love you all. And I always say, Lord, help us to help each other, Lord. Each other's cross to bear. Let each a friendly eat of food and feel one another's care. God bless you.
I went to see Ms. Brown to look into why she fell and talk about some of her recent memory problems. Though really the first thing we wanted to know was is she unsteady? And that had been what the consult was called for.
I had to go and I fell. Nobody came.
Yeah.
And that's why I'm like I am today.
Fist, palm, side.
Well, I can do, well, you know I can't do nothing.
No, you don't have to do it with that hand. How about with the other hand? Can you do that? Fist.
As much as I can.
No,
I
that's
have
it. That's good.
arthritis,
That's
you
good.
know.
Just put it right down on your knee, your fist, and then your palm. Quite a few patients actually get a little nervous when they see a neurologist come in, or if not when they come in, when they start up with the mental status questioning. Questions like, can you tell me where you are? Can you tell me what the date is? Do you know the months of the year? People get very concerned that maybe you think they're nuts or something like that. Okay, now touch your nose. That's good. And my finger back again. Okay, now your nose and my finger. I think this interview was difficult because Miss Brown was not comfortable letting us see those areas where she knew things weren't right. But I, on the other hand, needed to know precisely those things because I knew that I'd soon be presenting them to my attending, Dr. Poser. Deviation to the tongue to the right. I wasn't sure that that was a significant finding or whether that just happened to be accidental.
Well, now, wait a second. If she has a real deviation of the tongue,
Right.
what does that mean?
It means that there's something wrong with their cranial nerve
On
on
which
the right
side?
side, the 12th cranial nerve.
Yeah, I know. But the tongue deviates to the right, let's say.
Right.
Where's the lesion on which side?
Left side of the brain.
Left side of who?
Left side of the brain if it's...
Of the brain.
If it's cortical, but then it could
Do
also
you
be
ever
the
see
right.
deviation of the tongue from a cortical lesion?
I've never seen a deviation of the tongue from a cortical lesion. No.
Why is that?
Because I've only been in neurology about a week.
Beth, do you ever see deviation of the tongue from a cortical lesion?
No.
Why not?
The brainstem, many of the nuclei, including the 12th cranial nerve.
It feels terrible when you have doctors who you're looking up to for guidance and teaching, making you feel humiliated. And a lot of the experience of being in medicine is feeling humiliated. That's compounded by the fact that you change hospitals every month or nearly every month. You don't know where you are, you don't know any of the people, you don't know the procedures. So you feel like ungrounded as it is. And to have people accosting you with, you know, what's this minutia or what's that minutia, you feel bad. I believe it occurs in women more
And
often.
what kind of women does it occur in?
Older women?
Older women. What kind of
I'm not
women,
sure.
Beth?
Women have had a lot of kids.
You lose touch with your own strength in a way. If you keep staying in that environment and keep questioning yourself for long enough, you begin to think, I'm the one that's ignorant here. I'm the one that's faulty. Everyone else around me is wise and efficient and powerful and does a great job. And here I am, such a lowly little speck, you know. If only I could be like them. I am not clearly glad that I went to medical school. I wonder about it every day. I can't say that it's a bad choice. Certainly I had to do something in life. And I think medicine offers tremendous possibilities. But it's awfully hard to get there. You know, it's awfully hard to become a doctor. There's just so much to know. And right now, it's certainly painful for me.
This has been present now for 3 days, and he comes to see you as his doctor. What do you want to do and what do you want?
Severe pain, right lower quadrant.
That's right.
Okay. For the last 3 days.
That's what he said.
With the fever.
That's what he said.
What Dr. Falchuk is going to do with us, in this session is present us with a situation which we have to deal with, and we have to deal with it relatively immediately. The scenario is such that we have a patient who's acutely ill, and we're going to determine how the patient's going to be managed.
What do you want to do?
I guess we have to give him some fluids.
Fluid.
Does lungs sound okay though?
Lungs sound clear.
What's heart sounds? The heart sounds are fine.
The heart sounds are unchanged. They're
Which
normal.
one? Which one?
Normal.
Normal.
Normal. What do you want to do?
Start him on some fluids right now.
What do you want to do?
So the case today is going to be about this 60-year-old Greek goat herder, I believe, and he's going to present with some pain in his right lower quadrant, and it's going to be up to us to determine what we're going to do, how we're going to manage his pain, and any therapeutic measures or diagnostic tests that we want to do or ask for. Dr. Falchuk, who knows intimately all the things that could happen in this case, will fill in the missing, pieces of data so that we can actually pretend that this case is happening and unfolding before our eyes.
What do you want to do, Doc?
He has a tense abdomen.
Yes. Yes. What do you want to do? Whatever you want. You want to take him to surgery right away?
What's his weight test?
Yeah, get some labs.
Yeah, let's take a look.
How about you? Sure. Would you get an ultrasound?
I would get an ultrasound.
The ultrasound shows a large abscess in the area of the appendix. Would you like to operate? You don't have to, honestly.
It's a tough issue. I'm not sure if you need to operate because
Fine.
that could exacerbate
Okay,
the
so
condition.
then for your patient, if you don't operate, the next day he passes away from sepsis.
Okay.
Every fourth night, Tom is on call in the hospital.
I started at 6 o'clock yesterday morning. Very tired. My feet hurt. It's not too bad if you can get some sleep. I didn't. I usually don't. But I think as you get better at this stuff, that becomes possible. Might be able to get 2 or 3 hours of sleep, which could really make a big difference.
I don't know what to make of this numbness around her nose.
The neurology resident was saying...
As you enter the medical profession as a third-year medical student, one of the first things you learn is that there's a very rigid hierarchy of power. At the top, you have the attending physician who really is quite powerful, almost almighty. You could compare him to a deity in some religions.
I think the first thing to rule out is that she could still have just a plain old-fashioned gallstone sitting around the ampoule of water, and it could present all this business except the shape of...
And then right next to him would be the chief resident or senior resident, who would be a high priest, and he is the one who is allowed direct contact with this higher power. A little bit lower down the line, you have your everyday priests, which would be your junior residents and your interns, and they, although they don't directly speak with the Almighty, they do have the privilege of contacting the resident, who instructs them in the wisdom of the Lord there, more or less. Beneath your intern, you have your third-year medical student, who is, at best some little monk who definitely trembles in the wake of all of these greater powers, and hopefully will muddle through and climb up the rungs himself.
I think the clerkship system is a great way to learn medicine, but it's a tremendous strain on a third-year student because you get plunked down in the middle of a group of people you've never met before and never worked with before. And now they ask you to get to know them, work with them, spend 4 weeks together, and then you're totally dispersed and go on to a new place. So it's schizophrenic in a way. One day you're in the middle of a new group, you finally get in a groove, and then they drop you down into another group. It's a real strain. The Brigham has a 2-month clerkship, and it's in medicine, and so we do 4 weeks at the West Roxbury VA and 4 weeks at the Brigham Women's Hospital. And when you're at the West Roxbury, it's just very different medicine from a huge, teaching facility with tons of money. The VA system just doesn't have the same kind of money that Brigham does. As a medical student, since the staff is so overworked, you really get a chance to do a lot for your patient. And it's really the first time in my entire third year where I felt really needed. Like, they need me to do things. If I didn't do them, the patient wouldn't get as much done, because I'm one of 5 people that's going to take care of that patient the whole time he's here, and it's a really nice feeling. How this is doing. Mr. Patterson needed to receive chemical therapy, chemotherapy, for a cancer that he has in his mouth and in his neck. And in order to get that, he needed to have constant injections of drugs. And he had really no veins that you could find on his arms. You're a real challenge. I don't feel anything. All right. Well, we'll talk it over and see what we're going to do about that, okay? Come back and see in a little bit, okay? Try and get you a pillow, too. And so in order to get access to his blood to give him this chemotherapy for his cancer, we have to put a line in him. And there are big veins that you can get that aren't on the sides, but are in the neck. And so we're going to put one in his neck. And that'll be through his jugular vein. He's just anatomically right underneath the...
The other thing, and the other thing to try to do.
And when I cross over, do I go over this hand, I guess? I have to, right?
Well, I do the needle with the hand that is
there?
in the right place.
Really?
I'm left-handed, so it's easy.
I know that there are so many people along the line that are going to agree or disagree with the decision I might have, that I don't feel that I could really harm a patient. I mean, I'm in charge of them, I get to think about them, I get to propose what to do, but there's, an intern that then says, well, I would add this, or it checks my admission orders to make sure I didn't put something crazy on there, and then there's a resident above him and an attending above him, and we all discuss the case several times a day.
Now, one little trick is you want that needle on that syringe tight, but not real tight.
So I can get it off.
You're gonna have to take the syringe off there.
Right.
So.
Anytime you do a procedure for the first time, your adrenaline goes up, because you don't know what it's going to be like. You know that you don't really know what you're doing, and so you're sort of randomly shooting the needle in.
You still feel the pulse? Careful, don't stick yourself.
Yep. Just lateral to my what?
Middle finger.
When I was going for the vein, I was really afraid I wouldn't get it, and that I was just going to sit there and keep stabbing him, trying. And that's when you feel bad, because that's when you know that somebody who knows what they're doing could get that vein on the first try.
Going nice and smooth.
Like butter. Okay, now I got my finger on the wire.
Okay. Slide the thing off.
Okay.
There you go.
You know, a dilator? Or a little nick, right? If you can just stay still for a few more seconds, we're getting there.
When you get that advance all the way to the skin, hold the wire. Okay, you gotta hold the wire. When you advance it.
Okay.
No. Pull it back.
Mm-hmm.
Okay, now hold the wire at the skin. You gotta make sure it's coming out the back before you start pushing it through the skin. Okay.
It just feels like I don't want to pull it out.
No, you won't pull it out. I promise.
I was really nervous. I just wasn't going to get it and poke around for it. Sorry? Yeah, he hasn't had one. Oh, right, he needs one post-line replacement. Right.
What's exciting about doing things like this?
Smiling. I don't know. I don't know what it is. It's some people like the procedure, some people don't. I really like them. I'm not sure why.
I first met Sharon 6 years ago. We were both working in a psych hospital. And, well, my situation was very different back then. And, I think I was still married. Or if I wasn't married, I was just going through divorce.
I, Thomas.
I, Thomas.
Take you, Sharon.
Take you, Sharon.
To be my wife.
To be my wife.
Actually, the first time I saw Tom, he had held the door open for us. And that's when he was big and gruff. And I turned to my girlfriend and I said, I have no idea, but I'm very attracted to that guy.
Honor you. All the days of my life. All the days of my life.
And then it was like several months later before we started working together. And then I didn't like him at all.
Thomas, as you place this ring on Sharon's finger.
Then I went away to medical school, and she visited me during my first and second year. She moved up, and now we're tying the knot.
But Thomas, let me caution you. When you blow out your candle, that has a very special meaning. You are saying goodbye to your old flames.
can light this together or separately? Do we do this together? Together, right? Together we do this.
I'll blow out yours, darling.
I'm sure you will. Okay, here we go.
Sharon and I both have seen some tough times in our life, and I think we share a commonality. I mean, she's from a working class family, and I'm able to like relate my experiences to her and get some kind of reality testing and some feedback that I trust. And I find this very, very invaluable, especially at a time in my life where things are changing so fast.
These guys are freaking awesome.
And I think one of the strangest things about coming into this institution of medicine is that human lives and human drama is really an everyday part of your life as a doctor. And in academic medicine particularly, you know, there's interesting cases, and you sit and you hear about all the, you know, interesting disease, interesting this, interesting that, and all of a sudden you realize that's a person on the other end of this discussion. And sometimes I feel hypocritical about being excited about a case. I feel guilty almost because it's somebody, you know, somebody's illness that I'm excited about.
How's it been to be in a relationship when half of the relationship has a terminal illness? Is that hard to talk
Well,
about? If you don't want.
Do you want to talk about that?
Well, I think the attractions and my reason for wanting to enter the relationship that started the way it did were not unlike the feelings that two people have that perhaps aren't faced with this kind of disease.
It was August in Provincetown, and it was a very nice time, and my disease was not much of an issue at the time. It wasn't something that we had to deal with on a day-to-day basis, and now we're having to deal with it a lot more with this hospital stay. But
Well, it's good for me to hear, you know, your experience as a patient, because I'm sort of halfway in between the doctor world and the, you know, the outside person world. And so, I mean, I feel like you've given me a lot by sharing, you know, honestly, your experience here. It's very hard when you're young and alive and you don't know what's going to happen.
But that's kind of true for all of us.
It is true for all of us.
But I know I have
But you
some
know
different odds.
Yeah, and you also know that it's going to come sooner rather than later. Well,
I'm not so sure of that, Jane. You know, I mean,
There is a misconception about just because one is diagnosed with AIDS. Granted, many people do die within a certain time frame, but many, many people have lived a lot longer than that time frame.
and I don't know if I'm going to be an old man, but I also know I've had a marvelous life, and at 37 I've had many great experiences, and the quality has really been there, and I'd like to see it, you know, continue for a long time. But if it doesn't, the time I've had has been really, really something.
so like I got your emotions too. It's not very professional.
Well, you're only a third-year medical student, Jane. It's okay, you got time.
Well, I was out walking my wee dog.
Your wee dog?
Aye. And the pain came on me,
Uh-huh.
and it gradually got worse, worse, worse. And I went up to see my doctor the next morning at Beverly Hospital,
Uh-huh.
and they put me into intensive care.
How are you feeling about
I
this?
was
right
worried. I'm worried.
now? You're worried?
Yeah, but I know I'm in capable hands.
What are you worried about?
I mean, I've never had a knife put to me before.
You never had surgery before? The good
know-
thing will be that you won't remember what's been going on. And then when you start to feel better, you'll feel better, and they won't be giving you so much medicine. So.
Well, as long as I can go out here and play soccer again.
Okay, that's what we hope.
Yeah, I was playing soccer.
Until when?
Last year.
Uh-huh. Why did you stop? The chest pain? Yeah. Well, it's a good thing you went to the doctor when you did.
Yeah, well, when I walk out of here, I'll put on my kilt for you.
You will?
Yes.
Okay. I think being in an operating room is one of the most intense experiences one can ever have. And scrubbing in and actually having your hand on the case and actually helping when you feel needed is probably among the top 10 experiences to have in the world.
Free time. No problem. Yeah, that's it.
Right now there's a CABG going on, and that's a coronary artery bypass graft on Mr. Collins. And what's happening is they're taking some vein from his leg and then some other vessels that are in the chest wall and connecting them up to where the coronary arteries are, which give the heart blood. And it's been a little bit complicated because he has varicose veins, and so his veins haven't been as good as they would have liked.
This aorta's quite thickened, it looks like, too.
Can you, where would you see the RV from here? I mean,
This is the RV, that's the interior RV.
this is the interior RV?
Pickups? Yep.
Okay.
Wow.
We've got about...
This is the pulmonary artery.
Yeah.
This is the aorta.
Yeah, yeah.
This is the RV. The LAD's clear over here. You can't even see the left ventricle yet. You will, but you can't see it yet.
And now is all of that blackness from cigarettes or from...
Anthracosis, you get it if you
just
live in
get it.
Boston.
So even if you didn't smoke, it would look that way?
Those are the ribs.
Yeah.
Neurovascular bundles right in here.
That is really cool.
It's just a great place to see anatomy. Topical cold, please. Does get leaks, we don't have them. Let me check it one more time. Sometimes we're not as good as we are at others. There you go.
Well, I think I feel a little depressed right now because of the fact that he has such diseased vessels, and it's taking a little bit more time than we like.
Sure. They're right here.
Let me grab a hold of it.
Let's wait and see what happens here.
Do you understand what's happening right now?
No.
His heart isn't working, and Dr. Johnson is pumping. He's actually pumping the heart himself. The heart's failed. It's not working. It's not working. So that's what's happening right now, as we speak.
Lifestyle didn't change a whole lot.
I'm just, I can perfuse him.
You're just keeping him alive by
Yeah, right.
pumping his heart, and you're trying to think of something else you might be able to do. Oh, God. This is terrible.
The heart wasn't doing anything.
I feel like I'm bad luck or something.
No, come on.
I know, but
No,
it's like the one time I
I can
called.
assure you this stuff happens. Oh, no, I mean, that's right. I mean, the one time, and that's exactly right. I mean, we know because we do it every day that, several times a day, that this doesn't happen very often. It does happen.
That's on top. You can see the pressure. Bottom one is the
I can't
rate of
believe it.
pressure.
I told this guy he was going to do fine.
Conduit, we did okay with not having any conduit. All right.
That's it?
Yeah.
Oh, my God.
We got 11:37. All right. Have a stable, please.
I know, absolutely. Yeah. What can we do? Let me tell you something. No. Now, listen. I'm going to go up and talk to his family.
I never saw that. He was like...
I know. I know. Believe me. Believe me. No, it's okay. That's okay. No, you're not on my way. I'm concerned that you're concerned, and we've got something very important. You know, your responsibility is that you've established a rapport with this man as a physician, okay? A medical student, but as a physician.
It's funny because they were asking me about Dr. and I said, well,
Sure.
I've never really had a patient that I've gotten to know who's died, and here it's happened right to here, and it's like a bad dream or something.
Yeah, well,
like, let this be over already. Let him get, you know, it's like, who's going to wear his kilt? I don't know, I'm sorry, I shouldn't be.
No.
I don't.
No. You're attached in a way that is perfectly appropriate, but you have to understand all kinds of other things. Like, from the start of this operation, he could have, from the aorta, he could have had a stroke, and he never would have worn his kilt skin. I mean, you know, it would have been even worse.
I know, and I also know that he wouldn't have lived with his arteries like that anyway.
Oh no, he was.
I mean, I know
he
that.
couldn't do anything. Absolutely.
I know that. I know that.
But see, that's where
But
you.
it's so
that's
hard
that's
to
the
watch
physician
it.
part. I know. You have, but you have to be.
Okay.
You know. Okay. You have to kind of deal with it as differently than they do, and differently than you would if he was, you know, a friend. I mean, he's a friend, but he's not, you know, he's not. You're a physician in his situation.
I know. I'm actually okay when I'm with patients. Like when I have to be the physician, I'm okay. When I'm when I'm the bystander watching everybody, I don't have a role and I don't, you know.
I know.
Up.
I know. I understand that. Yeah, I understand that.
Thank you. Are you going to go up and talk to him now?
Yeah.
Do you want me to come to see?
You're welcome to. Yeah.
After 3 years of medical school, students often take a year off to pursue other interests.
I'm taking a leave of absence from the medical school, and in September I began my Master's of Public Policy at the Kennedy School of Government. And after I complete my year and a half at the Kennedy School, I'll return to the medical school, finish up my elective clinical rotations, and in June of '92, go on to my residency training in pediatrics, hopefully at a New York hospital.
David also decided to take a break. He traveled to Indonesia to do research on vitamin A deficiency.
For me, to get away from the Harvard environment was really important. I had already sort of lost some of the enthusiasm I'd gone into medical school with, and I was starting to feel that the hospitals were just sort of run like machines, and I was just a cog in the wheel. And when I came out here, I felt much more as an individual. Tidak mau ganti, ya. Tidak mau berubah, ya. I'm working with a group from Johns Hopkins who's doing research here on vitamin A deficiency. And they're basically studying the dose and the dosing schedule of vitamin A for children ages 1 to 5. And when I first arrived, I didn't have a place to stay, and I didn't speak the language, and so I was really stuck, and I was in the middle of a city I didn't know, and I just knocked on doors randomly, and nobody wanted me, you know. And then finally we knock on this door, and this 60-ish woman looks at me and says, "How may I help you?"
I asked him, what do you want here? So he asked for a room.
And I just couldn't believe it, because here I'd gone from room to room, and nobody spoke English, and they all kind of looked at me strange. And she invited me in, and after we talked for a while, she said she did have a room and that I could stay there. Pretty much, Ibu is my best friend here. She and I, we spend, you know, the afternoons, I always come home and we have tea or coffee and we sit and talk about things. And I mean, I learned all about Indonesia from her and about her family and her life. And she asked me about my life, and we're just very close.
He's part of our family now. Ibu personally don't like
to go to
young doctors.
Oh.
Ibu, huh?
Yeah.
Old-fashioned. I like old doctors.
More experience.
More experience. Yeah.
But do you think he's going to make a good doctor?
Oh, yeah. It seems so.
I always sleep with the windows open, and the first night I came, everybody was like, "Oh no, you got to close the windows." And I came in, my room was stuffy, and they closed all the windows up, and then I kept my windows open, and finally I got a cold. You know, sooner or later you're going to get a cold, and so everybody was like, told you would get a cold because the winds came in. Their belief is that if you get wind on you, you're going to get some sort of cold. There's this whole hot and cold theory of health in the Far East that I don't understand very well, but part of it is this wind blowing on you. So they believe, since they believe that you have caught some sort of wind that's now in you, they believe it has to come out. And the way that they get it out in general is croaking. And what they do is they take this coin and they rub the skin really hard until it gets very, somewhat inflamed. And then I think they think that that brings the air back out of your body, the illness back out, and cures you. It can be quite painful at times. After third year, by the end, I was really very unenthusiastic in my rotations. I just felt like I'd gone through a lot. I felt like I really needed a rest, and I'm glad I have the time off, because now I'm very enthusiastic to go back.
Right now I'm doing cardiology at New England Deaconess Hospital, and I'm really enjoying it a lot.
Mr. Burke? Hi. My name's LaWanda Grisette. I'm one of the students with cardiology, and we've been asked to come in and take a look at you because we understand that you have a history of some heart disease in the past, and we want to...
Cardiology is a study of the heart and the blood vessels associated with it, which means it's basically hydraulics. You've got a pump, which is the heart, and then you've got all these pipes of varying sizes attached to it, and you want to optimize flow through those pipes so that all the organs get enough blood. Mr. Burke has in the past had 3 heart attacks, and we don't have any idea of what his heart function is. He right now is in hospital because he's had these fainting spells, and he's been shown on one test to have very tight occlusions of both the arteries to take blood to the brain, and that could be a cause of his fainting spells. Mm-hmm. So would you say you have chest pain once a month or once a year?
Well, I've had them for the last 3 weeks. I've had more than I've had in the last 2 years.
Okay.
But not severe.
One of the things that I really like about cardiology, actually, is that most of the time you are dealing with an older patient population. The people who present with heart attacks and heart failure are typically older people because that's who the changes occur in. And I like working with older people. I like to chat with them, and I enjoy them a lot. I think they enjoy me. I was raised by my grandmother, so I guess I've always had interactions with older folk. And I see that being part of my career. I like to work with older people a lot.
When did you lose your wife?
A year ago.
Do you have any family here? Any children?
I have some children, yeah.
Well, I'm sure they have a stake in whether or not you're...
My baby's 38 years old. I don't worry about it. I've been around too long. I'm useless for anything.
Oh, no, I'm sure you're not useless. I'm sure that if you asked any of them, they would tell you that they need you around for counseling and advice and all the things that you probably don't think are important that are probably quite important to them. I'd like to get an idea of how well you get around also, how far you can walk.
I can tell you, but I gotta have something to hold on to.
Am I? Is my arm enough?
You'll do.
Okay.
Come over here, please.
Okay.
This is the only way I can get up at the moment.
Okay, that's good. That's good.
Will be.
Do you use a walker
When
at
you
home?
come back in focus, it's great. Okay. Only able to make it down to that nurse's office.
Now, you've told me a couple of times that you were afraid. Okay, we can turn around and go back here so that you don't have to worry. Now, how do you want to switch this around? You told me a couple of times that you were afraid that you were going to have one of those attacks. How do you know when they're coming on? How can you tell? Do you just know from experience what brings it on?
It's starting to work. This is what happens to me.
Your hand starts to shake, and then you know.
I can't explain it to anybody, really, because I don't understand enough.
Well, you're doing a great job of explaining. Okay, sir.
when we were out in the hall walking, it seemed as if he was getting a little dizzy. And I was happy that there were a lot of people around, and that's generally the case in the hospital, that there are a lot of people around to look out for things like that. But that's actually not that unusual. People getting up after being in bed for a long time will have the same sort of thing happen the first time they get out of bed.
Just one more.
For the past year, I've been taking all these specialties, like radiology, pediatrics, medicine, and surgery. Now I'm taking anesthesiology, and I really think it's a field for me. Not only do I find it interesting, it pays well, and it's got a good lifestyle. Although you get to the hospital very early, you tend to leave earlier. And now that I'm going to be getting married in a few months, I really think it's important that I choose a specialty where I'm going to be able to spend time with my family.
I had an accident with my toe, and I went to the Mass General Hospital emergency room, and Elliot was doing emergency room rotations at the time, and he actually worked on my toe and put the sutures in my toe and ended up giving me his number in case I had any problems afterwards.
And we went on our first date 2 months later.
Right. I actually called him up to thank him for all the work he did on my toe, and he asked me out, and we started dating right after that.
It'll be a year, November 29th.
Right.
Good morning again, Mrs. Kidder.
Good morning.
How are you?
Just fine, Doctor. Sit down.
Thanks. Nice to see you.
And you?
How's everything going this morning?
Pretty well, pretty well. Pain's pretty good, under control, and I'm getting anxious to get it over with.
I bet.
Yeah. Are you going to be an observer? Are you going to
I'm going to be an assistant.
Oh, I see.
I'll probably just be the person standing there,
Yeah.
handing Dr. Drew something or being an extra hand.
Yeah.
Mrs. Kidder was a 68-year-old woman, developed pain in her hip. While they were working that up, they found out that she had cancer and that it had invaded the bone of her hip. So about 5 or 6 months ago, they replaced her hip. Today what we're going to do is we're going to go in there and put in some plates and some cement to prevent her from actually breaking her leg, doing something maybe as ordinary as just getting up out of a chair.
Who has an 80-pack-year history, but has not smoked.
I'm Dr. Pierce, and this is Elliot Bennett.
Bennett, are you anesthesiologist or what are you?
Yes, I'm the anesthesiologist, and this is the Harvard medical student you heard about. From Dr.
Hi,
Drew.
good morning.
How you doing?
Listen, last night,
A lot of things I like about the field of anesthesiology. Number one, you play a very active role in the care of the patient. Although you have a brief interaction with the patient, I think it's a very meaningful one. You know, patients are very anxious before surgery, and I think that, you know, you can comfort them, you can explain things to them such that you reduce their level of anxiety and you make it a much more pleasant experience for them. Your blood, I promise you it won't hurt you.
Pretty well.
Now what we want to do is draw a line across, straight across to help us guide. Here's the patella, lateral shaft of the femur. Our incision is going to be coming down this way, like so.
Well, first, I think it's a real privilege, and it's a real honor, and I really enjoy just being there to watch this stuff. And this stuff is great. There's nothing more dramatic and more curative and more decisive than surgery. So if I did nothing but stand there and hold a retractor or just stand there and watched, I would really find it rewarding.
Harder the bone, the better for her. I want an X-ray, please.
People think of medicine like to think that you have to be exceptionally smart to do medicine, or you have to be exceptionally dexterous to be a surgeon. That's really not the case. What is the case is you can't be stupid and do medicine. You can't be a klutz and be a surgeon. But if you're reasonably well adept or you're reasonably bright, then you can do either one.
Actual reason for having medical students in the operating room is so that they can do this kind of work. Tighten the screws, do all the dog work. Now remember, this is the one with the lock in.
Right. So we don't want to damage those threads going through there.
So don't use the drill guide.
Don't use the drill guide. This drill bit will take those threads with it, beyond a shadow of a doubt.
Okay, let's get the smaller drill bit ready. Meanwhile, we'll get that.
Well, it's very intense work. I mean, seriously, you're concentrating every single minute you're in the OR. And unlike in medicine or a lot of other things where you spend a lot of time around the hospital just kind of talking to the nurses, having a coffee break. I mean, when you're in the OR, even when the patient supposedly is stable, you need to be watching the monitors. And it's like, you know, it's like driving on an icy road for 5 hours.
Absolutely. It's true. I think that's a good analogy. I like that ice analogy.
Yeah.
That's really what it's like. It's just like driving on ice.
Did a good job, Tom. Boy, you were, I'll tell you, now that we're fourth years, we're doing a lot of stuff.
You were great, man. You got that PA line and everything like that. That's really good. Those are tough.
Who would have dreamed last year that you'd be closing up and I'd be, you know, able to do the lines.
It's really good.
We've come a long way.
I'll say we have.
Midway through their fourth year, students must decide on their future specialty.
You guys took a little bit.
Elliot will become an anesthesiologist, and although Tom enjoyed surgery, he has ultimately decided to become an emergency room physician.
You feel exhausted even though you really...
The next step is to apply for internships around the country. A computer then matches up students and hospitals' choices, and on match day, the envelopes are handed out.
Hi, how are you?
I don't have one?
No, you don't have
Thanks.
I'm not letting you graduate.
This is great. Thank you very much. Okay.
Tom will do his emergency room training in Lansing, Michigan.
Sparrow Hospital, Lansing, Michigan.
Elliot goes to North Carolina to train as an anesthesiologist.
Duke! Good luck. Thanks a lot.
I'm going to be doing a residency in internal medicine at Boston City Hospital, Boston, Massachusetts.
Jay will also stay in the Boston area to train as a psychiatrist.
Cambridge Hospital.
Students often take more than 4 years to complete medical school. David is still in Indonesia, but will return to Harvard in the summer to complete his 4th year. Cheryl will also return to medical school after having completed her degree in public policy at the Kennedy School. And Luanda has now decided to postpone graduating in order to take a master's degree in public health.
We did it.
Congratulations. A big milestone.
For history.
Completed.
Finally, I get a job. It's my first job.
But for all these students, the 4 years of medical school were just a warm-up for what lies ahead.
Funding for NOVA is provided by Johnson & Johnson,
the signature recognized around the world for commitment to quality healthcare products for the entire family. And Lockheed, a bold new force in systems engineering, management, and technology services for defense, space, and industry. Major funding for NOVA is provided by the Corporation for Public Broadcasting and by the financial support of viewers like you.